For the following views, we're gonna use two cassettes, the 10 by 12. In the first cassette, we're gonna have two views, and in the second cassette, we're gonna have one view. All the SID that we're gonna use is 40 inches, and we're gonna have a left marker. Here we have a P2A hand. I will ask the patient to place their palmar surface into one side of the cassette and slightly spread their fingers, and the center ray will be directly perpendicular to the third metapophalangeal joint and centered to the film. For medial oblique hand, we're gonna place their hand resting palmar surface down. We're gonna rotate the hand laterally until a line through the metacarpophalangeal joint form a 45-degree angle with the film. The phalanges should be parallel to the film plane, and the center ray will be perpendicular to the third metacarpal joint and the center to the film. For lateral hand, we're gonna have a perfect sign with our hand, the way that our forearm and hand are resting on the ulnar surface. Extended the finger with the thumb away from the metacarpals. The center ray will be perpendicular to the metacarpophalangeal joint. For the following views image, we're gonna have one cassette and 4 views in the cassette. We're gonna have a SID of 40 inches and a cassette of 10 by 12. For P2A wrist, we're gonna put our forearm resting on the table with a hand and forearm parallel to the image receptor. We're gonna flex the fingers to place the carpals in contact with the film. The center ray will be perpendicular to the mid-carpal area. For P2A medial oblique wrist, we're gonna put the wrist P2A position, then rotate the wrist laterally until a line through the carpal form a 45-degree angle with the image receptor and put together the fingers. The center ray will be directly perpendicular to the distal radius. For lateral wrist, we're gonna have our elbow flex 90 degrees. They are resting on the ulnar surface. We are gonna extend our fingers away from the carpal tunnel, and the center ray will be perpendicular to the wrist. For ulnar flexion, we put our arm resting on P2A position on the image receptor, then rotate our hand laterally doing an ulnar flexion. The center ray will be perpendicular to the navicular. It's gonna be over here. For wrist carpal tunnel, we're gonna hyperextend our wrist and center the film to the level of the radial styloid. Long axis of the hand should be perpendicular to the image receptor. Rotate hand slightly toward the radial side. The center ray will be directly 25 to 30 degrees cephalic to enter approximately 1 inch distal to the base of the fourth metatarcal.